but we should put you on a transfusion regimen.
Okay.
If you really want to go, I think you'll be too tired to go if we start next week.
Okay,
But if you want to go, I don't want you to miss that. And if we start next week, or if we start August 24th, or the day you come back, I don't think you lose much by waiting those few weeks.
Great.
Okay.
But you should be on transfusions in the meantime.
okay. That will help me feel better.
Yeah.
Right.
Yeah.
Well, I'd like to go to the wedding.
Okay.
Yeah.
Be my last hurrah.
Grandma.
Oh. So, this is kind of it's not an odd question, but do you give me, somebody my age a lifespan?
I usually don't because it's difficult, but I will say this will affect it significantly.
Mm-hmm.
If you didn't have this, it would be much different, obviously. But what we're trying to do here, the goals is to put you in remission, don't need transfusions, and staying out of the hospital. Because whatever time you have left, I don't want you to spend it there.
Right.
You know about that.
Right.
And this diagnosis makes it difficult because once the medicine stops working, we don't have much else.
Mm-hmm.
It's like the holy grail of our whole field to find something for P53 AML. So I would say just take it a step at a time, see what happens every month, see how your numbers respond. And if at some point I tell you I don't think we should do more treatment, I'll let you know.
Okay.
But I think you're a good candidate for treatment now.
Mm-hmm.
I wouldn't be talking about all this if I didn't think so.
So you don't think her waiting 3 weeks is gonna, okay.
Yeah, I think it's more important for you to do the things you want to do than to
Okay.
get started on this.
What if I waited a year?
The blast will grow,
Yeah, I know.
the transfusions through trauma will get worse, the platelet
Okay.
will come down.
Okay.
So we can start on the 24th of August, 23rd, whatever that date is, that
Yeah.
Monday.
When you're coming back,
I think 25th or
5th.
something.
is that a Sunday?
25th is a Monday.
We come back on
okay.
a Sunday, but yeah, I think the 25th is a Monday.
Because your wedding's Saturday the 23rd, so the 25th we could start.
Well, don't quote me, it's 23rd, 24th-ish.
August.
24th. Yeah, the 25th then.
Okay.
That's a Monday.
Mm-hmm.
Yep.
Mm-hmm.
So we'll start your chemo infusion then. So is that infusion, is that considered a chemo drug?
It is,
Okay.
but it's not the usual chemo drugs that people get for like breast cancer and all these other things. So it's more of something that just works on the stem cells. So it doesn't have the same side effects. So you don't lose your hair, you don't have skin issues. It just kind of works there.
Very tired.
Mm-hmm. Mm-hmm. So, if I followed the plan that Dr. Hadadan recommended, where would I be?
I think if you do the 28 days of venetoclax, your curve will look like this. You just keep flat numbers will be low. You'll need transfusions 2 or 3 times a week.
Okay.
And it's not like it's going to make the blast much better.
Right. Okay.
It's too toxic. It brings the cells down too much.
Okay. Okay. Well, I appreciate all your knowledge.
Yeah.
And you sharing it with us and telling me what I should, not telling me, but recommending what's best for me, so.
Yeah.
Okay.
So let's plan for that then. It gives us some time to run things through insurance. There is one thing, if we're going to have some time, there's one thing I would like to do before you go, which is to run our molecular panel, but you don't need a bone marrow. We would run it on your blood, on the peripheral blood. Was that okay? If I send you back there to do that?
Okay.
And that way, some of the panels that they do commercially, they don't have some of the kind of newer genes, and we update it every month. And if there are any vulnerabilities in your leukemia that I can target now or later, I think that would be worth knowing.
And that's what you're doing by taking the peripheral blood?
Mm-hmm. We run gene tests with whole genome, so we look at the whole thing.
Okay.
So in your opinion, because it is genetic, is there a chance that gene is in our family?
It's a good question. So these mutations are only in your bone marrow cells. So they're not in the cells that you pass down to your family, for
Okay,
example.
oh,
Nice.
good,
You
it's
don't
a
need to worry
blessing.
about that. That being said, there's a lot of it is that we don't know, and patients who have MPN, like the ET, sometimes there are families that have it, but I haven't heard from you that anyone else in your family has it, so I don't think that's a problem.
What did Charlie have, your brother? Didn't he have a blood cancer?
He had some type of little blood cancer, but I don't know what it was.
Yeah, I wouldn't think so.
Okay,
Yeah.
Okay.
I wouldn't recommend genetic testing for
Okay.
like the family, right?
thank you.
Okay,
So I should pretty much do a lot of, getting a few things going as far as passing some of my things on to my children and giving money to my children, or is
I
that,
think that that's something you should think about,
uh-huh,
and it's better to do it now than to do it when you're in the hospital feeling terrible. That's
Yeah.
what I'd
for
say.
sure. Mm-hmm,
And so, yes, I in general encourage that to everyone,
mm-hmm,
but yeah, that's something you should really think about now.
mm-hmm,
So, I hate to talk about life expectancy, but I guess we have to wait to see.
The response.
Mm-hmm.
You know, the things that can go wrong with this are you can get your numbers to get really low. You can get a fever. If you have a fever, you need to come to the hospital. There's no way around that. You cannot stay at home and take a Tylenol. You cannot stay at home and take some antibiotics you have there to see if it works. Because the thing that's going to save you is getting IV antibiotics in your vein as soon as possible. And
so what does the fever mean, what does that indicate?
sepsis.
Okay,
And so if you have that, that's the thing that ends up taking our patients, infections.
mm-hmm,
And that's why we're gonna reach out once you start, so you can take some antibiotics to prevent that.
okay,
And just for reference, when you say come to the hospital, where do we go here? Cause we have a driver here.
Yeah, so the best, so if, it depends on, if she's just a fever and she's otherwise okay, then the cancer care clinic, you would call Nicole. Nicole's my nurse, you'll meet her in a bit. She'll give you some contact information, so you call that number. But there's also a overnight number, and then they get you placed in kind of our acute care center, which is like an emergency room, but just for our patients.
Okay,
So you avoid the ED down there with
Thank
the
you.
gunshots and everything.
yeah.
And then you just come to the acute care center, and that's a 24-hour thing. And then we get you admitted to one of our floors in the Parkview Tower.
Okay.
I hope we don't need that.
okay. Well, I'm gonna go to the wedding and party.
Yeah.
And then I'll come back and start getting your treatment,
That sounds great.
okay,
But we're gonna be doing transfusions in the meantime too, so we'll be coming back here for that.
okay,
And
alright,
we'll do that in the meantime. Check labs a couple times a week.
okay, can we have to come back here for that?
We want to come back here for that.
Okay, okay.
It's a short drive and I drive fast. Right?
Are you guys driving to Michigan?
No,
we're
we're flying, yeah.
Fine.
yeah.
What's the occasion? You said wedding?
It's a wedding.
Granddaughter.
Mhm,
Granddaughter wedding.
mhm. Whew.
Are you still taking aspirin and these things?
Yes, 3 times a week. Is that okay?
I think for now it is, but if your platelets get too low at some point, we may need to stop it.
Okay.
But
So
for the
should
next 2
I,
weeks, that's okay.
should I stop taking a lot of over-the-counter drugs? Like the calcium and the D and the K and,
You can keep doing that.
okay,
I would cold hydrate
yes, I haven't done that for several weeks.
this is yours, right? Yes.
Diet wise, is there anything she should focus on and anything she should avoid?
I would focus on whatever you want to eat. There are no real restrictions with the medicines or with anything else. So
Mhm.
whatever it tastes good. Especially when you're going through treatment, your appetite's not gonna be great. So really whatever you feel like eating.
Okay.
In general, I always say, try to get some protein in.
We're really good about that.
Yes.
We're forcing her.
And then if you feel like taking a walk, that's a good thing too.
No, I do need to walk.
Maybe after the transfusion, you'll get some energy back.
Okay,
Great.
great.
Okay.
Okay,
Other questions?
do we have your phone number?
Nicole will get our clinic packet thing to you in a bit,
Okay,
so you'll meet her.
Great.
okay, well, I'm ready then to.
Ready to party in Michigan?
So
Very nice
we
to meet
will, thank
Yes.
you, I'll get a blood transfusion today,
We'll try to see if we can get you in today, if not, be tomorrow.
Okay.
Okay,
And labs today, more
Right.
labs.
Yeah, one lab.
so if we, can't get a blood transfusion today, we could get one early in the morning?
Yep.
Yep.
So I could get back to St. Louis, Jeff City?
Yep.
Okay,
That's the plan.
okay,
Alright,
and they're gonna do a proof of blood draw today,
that's right.
okay. Okay, so will I see you at all during this process of,
So you'll be here 2 weeks after you start.
We'll see him.
okay, okay, great.
Okay.
Thank you.
Great to meet you.
Mhm. Yeah,
Nice
thank you
to
so
meet
much. You too.
So are you from United States?
No, I'm from Honduras.
Mm.
Is that
Honduras?
crazy? Yeah.
Okay,
Yeah, I came here for training. I trained in Texas. I almost stayed there, but I like the program here. The chemo program here is really nice.
okay,
Well, we're glad you're here.
yes,
Thank you.
absolutely.
Great meeting you.
You too,
All right.
thank you.
Please wait for Nicole, okay?
I will.
Alright, thank you so much.
I'm gonna leave this here if you wanna hang it on your fridge.
Yeah.
We're gonna frame that. Beautiful work.
Whew.